With Elena. Elena, remember, is 41 years old. That's my plan. My objective is first to correct the mid-face, to lift this up, to correct the asymmetry by injecting a little bit of voluma here laterally to make this equal, to straighten the nose, to make this more round on the temple here, and this is flat, so I want to make this nice and a little bit higher and convex, okay, and also she has a little bit of concavity here that I want to correct. For the lower face I have a lip asymmetry, so I will start with that side with Volbella. If it's enough I will stop, otherwise I will also inject a little bit here on the lower part. And then I will correct the pre-sulcus angle here, pre-jowl sulcus, here and here. And this is a little bit asymmetrical, so I will probably use more product here. Probably a bit of voluma here. Let's go. So, I use a needle. Cannula is for injection if I want to inject more areas. So this is the voluma with a 27 gauge needle. So what I will do, I will inject right here at 1 millimeter to 3 millimeter from the orbital rim in this mid face. And if you look on the profile, it's on the face, you see you have a concavity here, and that's what I want to correct. You see well the concavity, and that's why when the fat is sliding, then that's create the flat and the tear trough. Okay, so if the voluma is enough, I will not use another product to correct the tear trough. So if you draw a line from the pupillary lateral part of the pupil, the cornea, sorry, at 1 centimeter from the orbital rim, I make an oblique injection. I have the gel coming out, so I have a numb. Lidocaine is anesthetize a little bit the region. I go to the bone. Ulna? Chuchu? Speak, don't move the head. Okay, and now I start to inject, okay? So it's anterograde and retrograde injection. It's not a bolus only, it's like creating a volume under the orbicularis in this famous deep malar fat pad. So, I inject slow. When you inject slow, you have time for the lidocaine to work. Also, if you make a mistake, you can stop immediately, and it's less painful and less aggressive. So I move medially, and now I already injected 0.5 cc of voluma. Give me a gauze, please. Thank you. Okay, hold the syringe. Oh, sorry, this is 0.5 cc. Siva. So what you can see, do you have a black board to show one side and the other side? So look at the face now. This, compared to this one, just with half a cc of voluma. Here I'm using a Q-tip with a bit of hydrogen peroxide, just to stop the little bleeding. Turn your face laterally. And you see how I turn more? Okay. I shorten this lower eyelid, it's very short, and now I have this young mid-face. Compared to the other side, okay, more.
Нам хорошо видна разница после первой инъекции.
What you said? This is flat now and long lower eyelid. What is the translation? What she said?
Хорошо видно разницу.
Хорошо видно разницу.
Good.
Sorry.
So Jana is very tired. She translates in Russian to Russian. Fortunately, I understand. Понимаю. Okay.
You know Russian the best. Very tired. Распада скоро выучит русский.
Да. Понимаю чуть-чуть. Okay, so you see how this lady looks younger on this side, sorry, than the other side. Yeah, I just want to stop the bleeding a little bit. So I will not use Volbella now because Voluma is enough, you see. Okay, you just hold this like this. Yeah, from this side, okay?
Был у нас такой вопрос в зал. Сначала пришлите вопрос. Мне кажется, своевременно можно откомментировать.
Мы можем задавать вопросы сейчас во время демонстрации?
What?
Can you
Нас
they
есть
ask
вопросы,
you
да.
the question during your injections?
Yes, of course.
Да, конечно, вы можете задавать.
Скажите,
Конечно.
пожалуйста, как вы определяете иглу или канюлю выдать в данном случае?
How do you choose cannula or needle in this case?
So in this case, as I want to inject a bolus, I prefer to use a needle. If I have to do all the face like this, I will start laterally and do one injection point with a cannula. So now I want to inject on the temple. Ah, nice, perfect. So look at this side, careful. Half part, and look at this one, you see? So if you,
Big difference.
big difference, you see I created this triangle, half a cc of syringe, it changed completely her look. That's why I say to my patient, if you want to do your lips or this or this or this, invest your first money, your first rubli in this 1 cc syringe of Luma and the cheeks. Because I created this nice triangle, this is flat, and you see I lift the cheek like this, okay? So the second, as I don't do the tear trough, I will do the temple. The temple, remember, it's very easy to understand. If you palpate on your skull, you feel this lateral part of the orbit. Then the zygoma, this one is a bit broken. Then you have the linea temporalis, so you can feel it on your head. And the temporal fossa, then it's like a shell, okay? You know this company Shell Oil, so they have this shell. And this is the temporal fossa. The danger of the zone is, again, remember the zygoma, so that's it's the frontalis muscle, facial nerve, that's the zygoma. And the facial nerve crossed from the ear to the canthus, roughly at the middle here, coming from the parotid gland, going parallel to this arch, and then distribute with multi-branches here. The artery is posterior here, sometimes more medial, but you feel it or you see it. So what I do is I recommend to have a safe injection zone close to the bone here and away from these vessels and nerve. So, or you inject directly this area, or you make like a vertical line like this, and then a horizontal line from the canthus, and you have 4 quadrants, 1, 2, 3, 4, and you choose the one who is the most depressed, which is this one, and then this one. So in that case, I can use the voluma, the other cc, half a cc of voluma. Because I draw on the face, I clean again. This is very important. No, I need half a cc. Jana is very afraid that I use too much product. It's good for the company if I use a lot of product. So, injection in this area is 45 degrees. In this area will be 30 degrees because if you inject perpendicular, you hit the bone. So I start with this place, half of the needle up, I hear the crack of the aponeurosis. Bona? Yes, okay. Then I spread the product easily on the sliding space under the deep aponeurosis. This is 0.3 cc. You see the gel. Do this. Okay. You don't need a massage, you just ask the patient to bite. Okay, and this is done. And then I come from here, laterally, very safe, no vessels, except some little veins. And this oblique injection, you are under the aponeurosis, you see the product coming, and it's very smooth because the gel is under the aponeurosis. You don't have risk of irregularity. Okay? Again, the gel. Now we clean the drawings. So normally, of course, I don't draw when I do this in Cannes, in my office. For the lecture, it's important to show and to draw. Okay, so now we can also compare one side to the other side. You see this is round now, and this is more flat. You see the comparison? That's this side is smooth, and this side is more hollow. And the light is not symmetrical, she has more light on this side. Okay, so now I have finished with the temple. So it's half a cc of voluma
Вторые 0,5
and
пошли, да?
half a cc
Вторые
of voluma.
0,5 миллилитров.
The second half of volume you used
Еще
for this
посмотрите,
area.
как это
Yeah.
будет правильно.
Да.
So what?
Да,
They ask,
корректировали.
The patient was used half cc
Открытый, более
temple
свежий,
area and
более
half cc
молодой.
in
Yes,
the
half cc and half cc of voluma. Now I do the injection to lift the tail of the eyebrow and to make this more convex. You see it's a little bit flat. This is Volbella. Thank you. So the injection will be at 2 mm from the orbital rim, here, close to the linea temporalis, and I will inject 0.2 to 0.3 ml of Volbella. So I use a 30 gauge needle. I use 30 because this is the one in the box, it's easier to inject. In the tear trough and the lips I will use the 32. Open your eyes. Okay, you have to be careful with the veins here. So the injection is just under the auricularis, and then you slide on top of the bone, very gentle, anterograde and retrograde injections. You can do this with a needle or with a cannula or with a longer needle, but as the gel has lidocaine, and especially the lidocaine in the Vicross works very well, better than in Juvederm, I like to use the needle. For me it's more precise and it's sufficient. So now I have this little bit of bulging, the bulb. So what I do, I just put my finger gently. Una?
One.
Okay. And okay, so you see the, so I want to show you laterally here, I just create this roundness here. You see the round and the projection here. If you turn, you see this shape. Compared to this one, turn the face, which is flat. You see that it's dark, so she needs some more volume here. Okay?
We have a question. Насколько безопасно мы можем работать в этой области? Какие здесь анатомические риски, когда мы применяем
How
другие?
safe it is to work in this area?
So in this area, it's zero risk, absolutely zero, because you have no nerve, no vessels, nothing. Safe. Of course, you stay on top of the bone. You never go lower than the orbital rim. You don't go in the orbit, okay? So this is safe, and then I will inject here on top of the bone. Very safe, no nerve, nothing. So that's a perpendicular injection with Volbella. I was using a cannula here. I stopped because it's so difficult to dissect here with a cannula. So I'm using like 0.2 ml of Volbella. So just to show you, if you have here this with a Juvederm or another gel, you can be in trouble. If you do this with the Volbella, with the Vicross, and you make this magician, up, disappear. Okay? So it's a joke, but look at the result. See? Now it's very smooth. So I have a convexity, 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 like a C shape. and also here.
Very natural.
Very natural, and now for the makeup for her it's easier on this side because I create a projection here. Okay, and on the front view you see the difference. This is a little bit concave and this is flat. And that was 0.5 ml of Volbella. What we can do now is we can do probably the nose with this needle to straighten the nose. Normally I put the patient lying down and I start to inject from here. Now I will do from this side for the camera. Yes, thank you, Jana. Important to clean the skin. Okay. Again, and sterile goes. Close your eyes now. Okay, so you see there is a deviation because of the fracture probably. So what I want is to recreate another line. So, bullna chuchuta. This is a bit painful. So I want to recreate this line here. Is it okay on the movie? You see the gel is coming? Okay, so I don't need a lot of product. I want to come a little bit here because she had the damage on the bone. What I am doing is I am injecting slow, very slow. You don't need to inject very fast. It's important to get the product on the right position, and thanks to Vicross you numb the area and the gel is very cohesive and very easy to mold. So step by step you see what you do, and then when it's okay you just stop, open your eyes, you see, and now the nose is straight. Okay, so molding with fingers like this, you put your fingers like the shape you want to give to the nose. Okay, she needs a little bit of adjustment here, so that was point 2, great. So open your eyes. She needs a little bit of touch
Какой
up.
продукт предпочтителен с вашей точки зрения для этой области?
For this?
For this, for nose.
Для этой зоны какой продукт?
For what? For?
What product do you prefer for nose? For nose
If
correction?
it's just a refinement like this, I like the Volbella. If it's really to build the nose and lift the tip, for example, I prefer the Voluma. Because Voluma for this is too thick, Juvederm is a little bit irregular, so that's why for this very precise procedure, you see the shape now. Zoom out a little bit. Oh. So now we've got with 1 syringe of Voluma and 0.8 cc of Volbella, we've got this wonderful young face. Still a young face, but a little bit tired and sad on this part. Okay, so we can use the Volbella for the lips with the 32 gauge needle. 32
Yes,
is here.
32.
I have very good assistant.
I tried.
Open your eyes.
Закройте глазки.
Okay. So this is I don't use any EMLA, any anesthesia around the lips or around the eyes or the cheeks. Sometimes people are very stressed, so I put a bit of EMLA 1 hour before. But normally with this gel and the 32 gauge cannula needle, you start your injection, you start to inject when you are in the skin, at the junction of the lip, the red mucosa and the white lip, and I inject anterior grade, open the mouth a little bit,
Откройте ротик чуть-чуть.
chut, okay, open the mouth like this, and I inject anterior grade and retrograde, okay. Then you see that I finish here, so this is a little bit numb, a bit painful of course. The thing is, when you use EMLA, you hydrate the skin for 1 hour, and it changes a little bit the zone. Also, you can hydrate under the mucosa here. That's what I'm doing. And injection again is very, very, very slow. Okay. So if you use another gel, you will have this a little bit irregular forever. With the Volbella, you just put your finger like this. You just gentle pressure molding. It's not a massage, it's just a molding on the product. I feel it. Okay, and after that, you don't have any irregularity, even on the mucosa. Sorry, I need this one. Okay. So Volbella and the Vicross reduce the risk of swelling. It doesn't reduce the risk of bruising, because bruising it's the mechanical problem. So what we say is, I prefer to use the Volbella if the patient has to socialize, but I cannot guarantee that this will avoid the bruising. Now I want to lift this a little bit up, so I will use an injection here under the mucosa, very superficially, because you have the labial artery if you go deep on the muscle. Buna? Okay. Don't shake your head. Please open the mouth. So this is a projection, a dental projection. You see the gel is here. Sorry, try to show you. The gel is here. I feel it. So I just put my finger gently to mold the product. Okay. I forgot to ask you her if she wants to have just defined lips or big lips. Okay. So you see, I still have an asymmetry. So the lips, you know, we can think that tear trough is difficult, but for me, I think the lips is more difficult. So I will use more, a little bit more product here, because the line is not so well defined here. So I inject under the mucosa just to project a little bit more this line. And again, you see how soft and gentle I am with the injection. And already we injected 0.35 ml. Okay, so let's put this a little bit here, like this. Okay, I can finish hold this one. Perfect. In the meantime, I can do this. Can you zoom out, please? Okay. I will inject here on the pre-gel sulcus. I have 0.3 ml of Volbella remained. Okay. This is with a 30 gauge needle. I inject slow, but the flow is more faster. It's faster. Okay. Maybe I need a little bit more. It is 32. I use the 30 gauge. When I need to inject a zone and a volume with the Volbella, like here and here, I use a needle 30. If I need a precise injection, like on the lips or on the tear trough, I prefer to use the 32.
Здесь какой препарат вы используете?
Which product do you use in this area?
This was only Volbella. Only Volbella. But you can use Juvederm 3 or Juvederm 4 or Juvederm 2. The thing is with Volbella, it's very soft and very delicate. When you don't want to have a heavy jawline, that's good. And here the injection should be, don't zoom please, should be superficial, because if you inject deep, you are close to the vessels and to the depressor angulis ori muscle. Put your face down. Okay, you see that? Now it's straight. And now I have this dimple here. Okay? So already I have a bruise here on the lips. Anyway, we try to minimize these bruises. We will come back later. So now I want to finish the other side. She has this asymmetric face. So I use only 1 cc of voluma.
Yes.
So what? Yeah, I can use more. So I want to correct the chin asymmetry. You see here. So for this, I will use probably voluma. It's better. So deep on the bone. Now I recreate a volume here. That was a mentalis contraction. Bulna? Okay. Then I turn my needle. You can use a cannula for that, but look at with the needle, it's not that difficult. Okay. I'm creating I try to create the same volume. Stop with the camera. Stay centered. This. Yeah. Thank you. 0.5. You see, I have always a little bit of vessels here. No, don't use it. So when you have this kind of bleeding, you just put your finger, and normally it stops. But for sure, she will have a little bit of bruising here. This area, I don't know why, probably because there is a lot of veins, we always have bruising here. So the correction is not perfect, but it starts. You see the chin now is more balanced. The face looks less asymmetrical. So now I will do the mid-face. Look up. I have a syringe, it's okay. Again, using the 27 gauge needle, using the voluma to lift the cheek, to lift the orbicularis. I am under the orbicularis on the deep malar fat pad, very medial and very high. Don't inject lower than this nostril, the upper part of the nostril. Okay, half a cc. So that was half a cc and half a cc. It's 1 cc. Okay, so the result is good, but not perfect compared to this one. So we'll use the Volbella on the tear trough with a 32 gauge needle. Another one. Change the needle, because this one was for the lips. So don't use the needle that you have injected on the lips. No, I tell them. If you inject on the lips with a needle, don't use the same needle for the cheeks or the eyes, because this is a lot of different bacteria from the skin. Okay? Very important to change the needle. Okay? Спасибо большое. Change, give me another one.
У нас есть вопрос в зале, который звучит так. Для чего использовать волбеллу при коррекции носослезной борозды, если в этой области можно использовать волюму с более длительным эффектом?
Why do you use why you tell that you use volbella in the tear trough area if you can use voluma, because voluma is lasting more lasting?
Yeah, so it's not that I use voluma instead of volbella. I use voluma on the cheeks. If this is enough, like in this part, and lift enough to correct the lid cheek junction, I stop. But in that case, I need another product, and as the skin is very thin here, I will not use the voluma for sure, and I will not use Drivaderm in this area, because the skin is very thin and the muscle is attached to the bone. If you inject a thick gel, you will see the product immediately under the skin. So now I'm using a 32 gauge needle and a volbella. So take the syringe, please. Can you zoom?
Zoom больше.
Okay. And now I do the massage to push the product immediately. I don't know if you see the product is rolling under my finger. Okay. And now, if you look up. Okay. Straight. You see now I have this nice short eyelid thanks to this combination of voluma plus volbella. You see now she looks very younger and attractive, because you have the impression that the eyes is like this, because I corrected this area. Okay, zoom out. We finished the voluma on the temple on this side. Super. So instead of 2 injection points, you can use 1 injection point. Okay. So I'm very safe here, close to the bone, and I'm injecting like under the fascia temporalis, and I am. So I need to change the side because otherwise I don't. Can you hold the syringe? Okay. Спасибо, Jana. You can do the injection next time.
Yes, okay.
Okay, and then I do the lower part of the temple. Here and here. So that's 0.5 cc. Okay. You have to be careful with these little lines here. Now we prepare the volbella with the other.
This one?
This is for the lips?
No, I changed the needles for
Okay.
both.
Perfect. So I change this one.
Будьте добры, у нас появился в зале следующий вопрос. При работе с скуловой зоной, вернее сказать, носослезной борозде, как не повредить нервус инфраорбиталис?
How to avoid
Какие
damage
рекомендации?
of infraorbitalis nerve working in this area?
Okay, I have the answer. This is the infraorbital nerve here, the notch. This infraorbital nerve, if I draw it, okay, give me the white and the black, the white and the black. So the orbital rim is here. This is the pyramid fossa, this one, okay. And you see it's like half a centimeter from the orbital rim and very medial. If you want to know where it is, you see this supraorbital nerve, you have a notch here, you can feel it on your face. That's the place for the supraorbital nerve here. If you make a vertical line from this line, you have on the same line supraorbital nerve, infraorbital nerve, and also the dental nerve. So the infraorbital nerve will be here, going down here, and the dental nerve will be here, on the same line. You see this on the book, very easy. So what I was doing is, I was injecting, the voluma was here, that was my voluma injection, and the volbella was a little bit higher and was here. So I was away from this infraorbital nerve. If I draw it here, again, that's the injection of the voluma. Voluma was here, and volbella was here. Okay? So I'm away from this nerve. By the way, if you touch the nerve, the patient will tell you that it's painful and you stop immediately. There is not a lot of danger. The only thing it's not pleasant for the patient, for sure. That it's not a big risk, like touching an artery or the facial nerve, which is not a sensitive nerve. The facial nerve is all the motricity of the face. Okay, so what I do now is the eyebrow. Do they need more explanation on this infraorbital nerve? It's okay. So here again, no danger. If you don't know where to go, you just grab the skin and the muscle. You see? That's the sliding space, and you put your needle under. Okay? Very simple. Sorry, I was too high. That's the problem when you do live demonstration, you talk and you show something you never do. Of course, I never grab the eyebrow. Okay, so because I have a little vein here, so I start lower, close to the bone. Bolna, чуть-чуть. Open your eyes. Открыть глаза. Super. You know, I should have learned Russian. When I came 15 years ago in '98, Should be fluent in Russian now. But they said if you have a girlfriend, you are more fluent. I try, but I still not speak enough good Russian.
I know very good.
Okay. Then I need a little bit more here. Okay. Perfect. Right. So this brow is higher. So what I propose, lift the brow, lift this.
Поднимите наверх.
I can inject 1 unit of Botox just to relax this part. We have Botox? 1 unit?
Yes, 1 moment.
Here we go. So when I have a bruise, I just put my finger and I wait. 1 unit. Just 1 unit. As I don't want to stay without doing anything, I just start with another injection here to make this pre-gel sulcus more even. So I use the other part of the voluma because I need a stronger support, stronger than the other side where I was using the Volbella. Okay. And then I will finish. Yeah, give me this 1 drop. Okay. Lift the brow. Lift. Don't zoom. Don't zoom.
Не трогай.
Lift the brow.
Наверх поднимите.
Okay. I have a hyper contraction here, so I just inject here 1 unit on the frontalis. Okay. So this you have to trust me because it doesn't work immediately. Just will relax a little bit this high brow projection here. Okay. What we can do?
Как глубоко вы вводили препарат в области подбородка?
How deep you inject in this area?
So this is it's under the skin, on the subcutaneous. Because if you inject deep, you are in the depressor angulis ori, in the facial artery, and you have also the facial nerve. So people who inject deep there, I think it's stupid because you take a lot of risk. In the chin it's okay, but it's in triangle it's dangerous. So I inject superficially. That was a deep injection of voluma to recreate the chin, and this is superficial injection of voluma. Okay, and now I finish. Okay, you want to correct a little bit, open the mouth a little bit.
Немного откручу.
Okay. This is to correct a little bit the lip asymmetry. Okay.
Сейчас у вас волбелла в руках.
Do you use Volbella?
Правильно мы увидели?
Yeah, I use only voluma and Volbella in this face. Okay. This is with Volbella with 32 gauge needle, very slow injection, anterograde and retrograde. I control my injection, and then after the injection, immediately after, I do a massage, a molding. And this product...
Возможно ли, извините, возможно ли создать четкий контур при помощи Volbella?
Is it possible to create a strong contour with Volbella?
What do you mean by strong? What do you mean by strong?
Что вы думаете под четким?
No, they translate.
Пока не понятно.
You can create a contour. Okay, it's not as visible as you can have with Juvederm Smile or 2 or 3, but you can create, you see this, can you zoom now?
Побольше zoom.
You can create, you see I created a little bit of a contour. She doesn't want a big lips, but you see that can make this contour. And with this product, with the Volbella, we know that if you use this Volbella, what you do now is what you get in 1 month. Because if you do the same with the Juvederm, and even with the other products, you have more swelling and more water absorption, and from this you can have too much, okay? That's why I like in a nice young lady like this, who just want a refinement on the lips, I prefer to use Volbella. Of course, if I need more volume, I will use probably Juvederm, but I think in your future you will have another gel from Bicross that will be very nice for the lips also. So I forgot to do this one. I need to keep 0.2 cc for here. I still have an asymmetry of the lips that I try to correct. On the screen it's visible. So try to do this. Open the mouth. The thing is, everything you do on the lips is traumatic, so I don't want to ruin my result with a big bruising now. And usually it's what happens when you finish. You do the touch-up and then bang, you have a vessel. So be very safe, very slow injection superficially under the mucosa. I have a little vessels here, so I do a bit of pressure. And then I wait for this molding. Okay. In my office I use ice pack and I use like kind of arnica or cream. Okay. You have. Okay, so it's finished. I have to finish. You see, I corrected this asymmetry, which was a little bit difficult. And let me finish. It's finished. No, it's done. We remove this one. Спасибо. How do you feel? Хорошо?
Можно еще один вопрос задать, который нам прислала публика наша? Нас спрашивают, встречалось ли вам такое осложнение после введения филлера, как появление гиперпигментации? И как можно предотвратить это явление, если да? И можно ли дальше работать с этими пациентами филлерами? Ghiperpigmentaция после инъекции филлера.
Any hyperpigmentation after
Бывает ли
injection?
такое?
After injection.
Yeah.
Was any hyperpigmentation in your practice?
Hyperpigmentation?
Yes.
No.
Yes.
After injection. Yeah.
No. What you have, which gel had give hyperpigmentation? No. Okay. If you have a hematome, that can give hyperpigmentation, but the gel never. The gel never gives a pigmentation. So what we can do, what you can have is, because zoom here, please. She has hyperpigmentation here. It's not visible. So when you stretch the skin, sometimes it's white. Sometimes this was not visible because of this. And when you inject, then it's probably visible. But I never get any hyperpigmentation with any gel in my life. I've got with laser, that's why I stopped. I've got with chemical peel, that's why I stopped. Okay, so Elena, I think it's finished. Are you happy? 3 and 3? So it's a joke that I use, normally I use too much product. So this is the result, zoom out. I have a symmetry now, almost a symmetry on the brow. She looks more attractive and relaxed. Look at the feature, it's very delicate. She looks like a model now. You can do photo model. Nice jawline. This is a little bit heavy. I feel here. We'll have for sure ecchymosis here and probably on the lips. So then the contour, I make it this more symmetrical. And you see the contour, now the nice OG curve here and the nice contour. Put your face on the profile. Okay. And I like this injection.
Что вы еще посоветуете нашей пациентке к следующему этапу? Какую программу?
So the next stage will be don't exercise for 24 hours. Nie bania, nie sauna. Also, alcohol, vodka, everything okay. Wine, okay. Vino. So the only thing is exercise and massage and sauna forbidden for 24 hours.
Next